And you can see here this is a dense white cataract with also a large zonular weakness area here. So it's not quite a dialysis, but there's a significant weakening of the zonules. This case also required a capsular tension ring, and the reason for that was the zonular dialysis. So you can see here as we complete the capsular rhexis, we move on towards addressing the nucleus. So you can see the capsular tension ring being inserted here. This is stabilized. There's so many loose onyls. You can actually see the ring here shining, glistening at the equator of the posterior caps of the lens, and you can see it kind of spinning around at the equator because we have access to a view of the equator from this video. And so this is the injector system for the stabilized, and now the capsular tension ring is in the bag, and you can actually see that this gap between the iris and the lens has closed, meaning that there is more stability out there. So now I feel that it was possible to use the signature phacoemulsification system to remove this cataract. And we're going to show that here next. And one of the amazing things is, here we go with the phacoemulsification. You can actually see how stable in this very unstable capsular bag, how stable the environment is. You can see it's mainly a fluffy cortical cataract, but within just a few seconds, this material was removed without any really bouncing of the posterior capsule or any shallowing of the anterior chamber. So we were able to safely implant a 3-piece Technis acrylic lens in the capsular bag. We closed the eye with a suture, and at the conclusion of the case, the patient looked very, very good.